It's Randee with Realign by Randee. I'm here by myself today, no assistant, but I'm super excited about the topic today. It is about surgery and avoiding it. So a big thing is if you are hit by a truck and there's a lot of trauma, or hit by a car, you're going to need surgery and you can't avoid that. Certain things, it's life-saving, it can be amazing. So trauma, we don't have a choice. But in a lot of other things we do. So we're gonna kind of talk about some different, we're gonna kind of go a little bit major joints and stuff, head to toe. And we're gonna talk about the ease or difficulty of the rehab process, some of the outcomes and risk factors of doing it or not doing it. So let's start off with the shoulder. Common things that people get surgeries for are rotator cuff tears, labral tears, sometimes it's biceps tendon tears. Sometimes people just go in and debride because things are rough in there. So first of all, big thing about shoulder surgeries, I do feel the rehab process is quite long to really get back to feeling great and functional. A lot of times you can be immobilized in a sling for a period of time. So if you are right-handed and you do a right sided shoulder surgery, the recovery is even a little bit longer because you can't help yourself. You need more help from others. So in terms of the shoulders, I think it really does depend on what activities are you trying to get back to and why are you doing that. Someone young and active and is trying to play a certain sport, there comes a point where you may not have a choice in order to keep up with what you're doing. If you're missing out on lots of activities and are having a tremendous amount of time, difficulty sleeping, that can really interfere with people. So that's a reason to consider your surgery, but just knowing that the rehab is long and you have to give it a good effort, and I'd say the outcomes overall are pretty good when you do the whole rehab process. But I will say that if you do posture alignment and Egoscue, a lot of times, I feel like shoulders is an area where we have some influence and play if you want to avoid having surgery. Because if things are happening in our hips and are uneven, and then our shoulders are uneven, or we're very rounded, we are putting that shoulder to begin with in a very tip forward, compromised position. So it makes the space between here's your arm bone and right here, and then back here with your shoulder blade, they kind of have a space. And anytime that's compromised by the positioning, that is going to narrow where things are sitting, causing more pain. So definitely think it's a great place to put alignment in as an option, because if we can get our body sitting in a better way, that shoulder may feel a lot better. Okay, so moving on, let's talk about the spine, because the spine is really neck to the low back. Obviously much more common to have surgery in the cervical and the lumbar than in the thoracic, the mid-back. So the big thing here that I want to get is, when is it really highly likely that you should have surgery or sort of necessary? The big thing that happens with the spine is because the spine houses our spinal cord, which controls the nerves going to our arms and our legs. If you lose function, you are dropping things, you are weakening in your hands, your foot is dropping and you can't control it. A true weakness of a muscle, that's one big reason. Loss of sensation, and I'm not talking about when people say, I feel tingling, I feel kind of a numbness sensation, but if you feel it, that's not really true numbness. True numbness is somebody touches and you are not feeling it at all. If you are losing the ability to feel it all in your hands, your fingers, your feet, that is another sign that something's really being pressed on. Third big thing, not always talked about, but bowel and bladder. If you are losing control in any way, feeling something different about holding your urine or holding your bowels, and something just feels different, that can be a sign. And then of course you've got back pain or you've got some spine issue going on, that is a reason to consider doing surgery. All these are a sign that something could be pressing more on the spinal cord, and you wouldn't want that to get worse. You don't want to lose more function in your arms or your legs, or lose your bowel and bladder, things like this. So those are when I feel with a cervical and a lumbar or even a thoracic, when a surgery is more likely needed. When it comes to pain with neck and back, it is much more optional. The outcomes are much more mixed. So I've seen people with some great results. I've seen people with good results for a period of time and then something returns. A lot of times the pain that you are having is not coming from necessarily that very specific herniated disc or some degeneration. It is coming from the imbalance of the muscles that are putting stress on the spine. So with posture alignment, you can even things out and feel a lot better or manage your symptoms. Again, going in for a spine surgery is risky, so you want to weigh all of that out in terms of choosing that. Okay, so as we move down the body, we're going to get into hips now. So the big one is hip replacement. So what I will say about rehab with the hip replacement, it is probably one of the easier rehab processes of many orthopedic surgeries is the hip replacement. Most people go in with a lot of pain and come out having less pain. Yes, there's some, the surgical site has some pain, but it's a very easy rehab process in most cases. So that makes it a good option. However, the thing to remember with that is if your hip is wearing away, it is very much at the center of our body, and likely there is some imbalance that contributed to that hip. Even if you played a sport and got knocked around, most likely there is muscle imbalance that is affecting things. So if it affected that one particular joint, it is likely that eventually it will affect a joint above or below or across. Very common that people need one hip replacement, then they need another hip replacement. So it really depends on the stage of wearing out of that hip, whether or not you absolutely want to go through with the surgery. If it's really worn out, it might be a great place to reset, but alignment can really come in preventing further surgeries. If you have a little bit of arthritic changes, that is the time where alignment can really prolong and postpone that need for surgery of the hip. Lately, there are also a lot more labral tears and things like that. So there are newer surgeries in the last 10 years. So let's go on to the knees. Okay, first one is the ACL. So that is so common in our athletes today. It's common in a lot of different ages because we have people playing sports and doing activities at all ages now. And I will say that rehab process is definitely lengthy to get back to your full function. However, that rehab process generally starts a little quicker than the shoulder surgery. You generally can get into your therapy very quickly after an ACL surgery. Just the nature of the recovery depends on where they took the ACL from will affect your rehab a little bit. But again, it takes time. The thing about the ACLs that you see is that most people that want to go back to sports and have instability in their knee will likely have an ACL surgery. That seems to be a common trend. There's definitely some stem cell stuff that's being done that you consider. So if you're somebody that's not playing a high level sport, there are other options for you to consider doing alignment, other things to help promote any kind of good growth by the body. Not that it's necessarily, it depends on if it's fully torn or partially torn, whether or not you can get some scar tissue going on. So I feel like the meniscus is, again, kind of a big variant in surgery choices. I feel like if you were looking for the quick fix, a lot of times if you have knee pain and there's a tear, you can go in, debride it, get it out. But if you look at why it tore and physically what's happening besides just blaming it on some activity you did, maybe what was the body aligned like that went into that activity, you can kind of step back, and alignment may play a big factor in things when it comes to meniscus. So I do think sometimes people get a meniscus surgery a couple years later, they still have knee pain. So that's why I feel like that's a big one to really consider taking your time on rushing into surgery with that. and looking into your overall alignment. Okay, so as we move down the body, we are going to go into the foot. Again, I'm kind of just covering the major stuff right now. So when we go into the foot, common surgeries, really foot and ankle, but one thing is a bunion surgery. So bunion surgeries, again, I feel like it's a little bit of a surprise, can be a little bit lengthy on the rehab process. I think sometimes people don't realize that takes time, and sometimes the toe bone, the toe doesn't move as well, and it really takes time to get that motion back. A lot of sensitivity after that surgery. I have seen some really great outcomes from bunion surgeries, but I've also seen situations where even with the bunion surgery, people are still having pain, or because of the mechanics that caused the bunion in the first place, 10 years down the line, the bunion is back. So I feel like the bunion's definitely one to really consider. Okay, is it really severe? And do I just want to get it straightened out? And the pain is so severe and the shoe wearing is difficult. Otherwise, I do think that there is stuff that you can do to really slow the progression of it by working on your alignment. Okay, so I'm just checking to see. I see possibly a question. Okay, I see people are there, but I'm not sure if you have a question. So if you can, maybe stick a message or something that says, hey, I'd like to ask a question. Otherwise, I'm just gonna keep at it. Okay, so with the bunions, I feel alignment, a lot of times the hip above is not functioning well. The hip above, the misfunctioning bunion, but again, we're all tied together. Sometimes if one hip's not working well, what's happening with our shoulders to compensate? Are our feet arches working well? So a lot going on with that. In terms of, there's hammer toes, some other feet kind of surgeries, just other things are, I would say, not as common when it comes to the foot. And also maybe if you're talking to a podiatrist or foot specialist, I'm sure they have lots of different surgeries that they are doing. But many times it can be what's happening with the overall alignment. Again, if somebody sprains their ankle and tears a ligament or a tendon, a horrible sprain or something like that, something may need to be reattached. And I think that's important. There's times when tendons tear, a muscle, if you tore a calf muscle, you would want to put that back together. But again, we are looking at alignment, the why is that body part under such tension and load, not just the force that came and knocked it around. Okay, so we've sort of gone through the body. In terms of wrists and hands, I just want to touch through that a little bit. And elbows. Elbows, again, I don't feel like it's that common to have surgery. We get tennis elbow, golfer's elbow, tendonitis, all these things. Those are things that absolutely can be helped with doing alignment. A lot of times it has to do with the forces with our shoulders. But in terms of the wrist, I would say carpal tunnel releases are probably a more common surgery. Again, I'm not a hand specialist, so I've not done as much rehab on the carpal tunnel. But I will say, in terms of preventing that and avoiding that, you are looking at what's happening at the feet, the hips, the shoulders, allowing less force on our wrist. It's also ergonomics, mechanics. What are you doing at your desk and your computer that's putting so much force and creating some swelling in this area that creates the canal being narrowed. So that's our big thing. So this is about avoiding surgery, knowing different rehab options, and then outcomes. So I'm gonna now look a little closer to see, still learning my Facebook Live. And okay. I don't know, it doesn't look like anybody's asking a particular question. It just looks like some people are watching. I am going to be doing Facebook Lives for some Thursdays going forward, and I have some topics planned already, but I'm always open to other topics. And another thing is I do have my work from home survival kit, and it has to do with some tips for sitting at your desk, making your a do-it-yourself standing desk, using the phone in different places. So if you'd like these tips, you can just go to the link on my website. It's on there, and you can get one sent to you for free. Okay, I'm happy people are finding the information helpful today. So I look forward to seeing you more in the future.